here at the 4th Annual Glaucoma Patient Summit in Oak Brook, Illinois, and joining me is
Julie Grutzmacher, Director of Patient Advocacy and Population Health Initiatives at Prevent Blindness.
I know Prevent Blindness has a patient engagement program called Aspect with a strong focus on advocacy. Why is building advocacy skills so important for glaucoma patients?
Building advocacy skills is so important because it's really about engaging in your healthcare. It's meant to be very participatory, and we talk about small A advocacy and big A advocacy, and we want to teach those skills. So small A advocacy could be talking to your provider, making sure that you ask all of your questions, making sure you have what you need to remember everything that was discussed. And really, it's all about improving health outcomes for glaucoma patients, and every patient is different. So it's important to just have a dialogue in the aspect sessions, meet other people who have a variety of eye conditions, even outside of glaucoma, and just become equipped with ways to empower themselves, whether it's, as I mentioned, small A advocacy, or even being able to be exposed and gain some practice. We do some role playing for like a mock legislative session. So that's the public policy and advancing legislation. And all of that is important because advocacy really is about taking action and participating in your health care.
How can caregivers, clinicians, and allies better support patients?
I think one thing that they can really do is to individualize and not make assumptions. So that really is about listening to the patient, listening to, first and foremost, what is most important, what are their priorities and goals. And that can be short-term and long-term, but then really factoring that into the plan of care for them. And so especially for clinicians, but then, caregivers as well and other allies, not trying to impose your own agenda, but to really invite the patient to, co-create or to participate in their care.
Why is an event like the Patient Summit important?
I think it's really important, especially on the heels of the pandemic, to bring people together in person and be in community, to learn so many new things, the cutting edge research, advancements in technology, and then to meet clinicians and researchers, but also to meet other individuals who have glaucoma as well. There's immense power in meeting people and coming together in community, especially when it comes to advocacy. You really build a momentum that is so important when you're feeling discouraged on a possibly day-to-day basis.
Can you share with us some of the most effective resources you have come across for visually impaired patients?
I think, the first thing that comes to mind is the Aspect program, like you mentioned. The Aspect program is about 2 years old now, and it's a training program for the visually impaired and blind, and allies. So we all come together for a period of 8 sessions, and we talk about a variety of topics. And that is, really empowering for both patients and providers. And it's patients and providers learn so much, and they meet new people, and it's a great networking opportunity. So that's one thing. We also have our Living Well with Low Vision website on Prevent Blindness, and there are so many really wonderful resources that are, that sort of target a variety of eye conditions, but especially, there are resources for glaucoma. In addition to that, we have the Glaucoma Community app, which is pretty new, and that's a wonderful way to be able to get the latest research. It's heavily vetted by our expert committee, scientific committee. So they vet the news feed that is on there. They vet all of the research that is posted, and it's a way to pose a question to your community and get some answers, as well as you can include your medical information on there. And it's an easy way to share it with your providers and take it with you wherever you go. It is safe and secure to do that, to upload it there too.
Good to know. I'm actually on the app myself, and my favorite part is being able to customize the news feed.
Oh yes, that is a great feature.
Yeah, love that. How does your participation as an exhibitor and speaker fit into Prevent Blindness overall mission?
So the Prevent Blindness mission is to prevent blindness and preserve sight. So we really do this by education, advocacy, and empowerment. So really, I think being here, being at the booth, being a participant in the panel, it really sort of touches on all three of those. So education, advocacy, and empowerment, the more education you receive on a topic, the more empowered you feel as a patient, and that can lead to new opportunities and in advocacy. So that could be feeling more empowered to express a certain concern to your doctor, or get a second opinion, or really take charge. And it can be also then feeling empowered to participate in advocacy days and work towards the long endurance game of passing legislation to improve people's lives, and ensuring that certain medications are covered by insurance and assistive devices and all of that. So that's really the long game. But I think participating in this panel and being surrounded by like-minded, passionate individuals who have diverse skill sets is very invigorating when it comes to working at all levels of advocacy.
I love your message about the long game. It makes a lot of sense for visually impaired patients, because obviously we don't have a cure to restore vision just yet. So joining the long game makes a lot of sense. All right, Julie, thank you so much for your time. It's been wonderful.
Thank you so much.